where the complications start. We are going into the carpal region. And what we're going to do, first of all, we're going to go from more general motions to more specific motions. So the first thing we want to do is move the rows of bones. And the rows that we're talking about are the row of the proximal row and how that moves relative to the radius and ulna. Okay, so that's known as the I should say that's known as the radiocarpal joint line. Right, radiocarpal joint line. And then we're going to do exactly the same tests to the midcarpal joint line. So the proximal row, how that moves relative to the distal row. Because these rows actually should move as a functional unit, in particular during the normal motions of the wrist, the four motions that you know. But remember, these are accessory motion tests. They sort of look like, and they mimic some of the osteokinetic motions, but we're going to add even more motions besides that. Okay? So, here's how it goes. I have my patient. She's going to put her hand up. I can see the bumps. That's my landmark. My first contact is going to be, you guys want to just come around. My first contact is going to be proximal hand, be hand closer to her. It's going to be circling proximal to the bump, radius and ulna. Distal hand, just distal to the bump on the proximal row. Notice there's a little bit of space between them. I'm going to get into my power position, right, my stable position. And I've got 9 motions. The first one is distract, LAD, spring, spring. So tell me if you have any pain or discomfort. Spring, spring. Anything there? Then I'm going to do 4 glides, then 4 tilts. I'm going to glide down. I'm going to glide up. I'm going to glide away. I'm going to glide towards. Anything there? 4 glides. Now I'm going to do 4 tilts. I'm going to tilt up. I'm going to tilt down. I'm going to tilt away. I'm going to tilt towards. 4 glides, 4 tilts.
Are all of these to the end of range?
Yes. You're always taking out the slack. You'll feel the tension. Oh, there it is. Spring, spring. Take it the other way. Distract. You know. So now the glides are P to A to P, medial to lateral, lateral to medial. The tilts are anterior tilt, posterior tilt, medial tilt, lateral tilt.
You don't call it flexion extension?
Well, you can, because really anterior tilt is flexion. But we tend not to with accessory motion. Try to keep it clear that these are the accessory motion tests versus like an osteokinetic motion palpation, which does flexion extension ABAD. But really, your tilts are flexion extension ABAD. It's exactly the same. But now we're taking it to end range and spring.
Do you keep it distracted the whole time?
A little bit of LAD the whole time. You want to open up the joint space a little bit as you do your 9 directions.
So are you kind of like applying like a counter force with your hands when you...
Yes, when you do your glides, this hand comes up, this hand goes down.
Right.
Spring, spring. Go back the other way. Glide away, glide towards. When you're doing your tilts, you're going to, you know what'll happen is your knuckles will hit and you'll distract, spring, spring. You'll come back the other way. Your fingers will hit, distract, spring, spring. Your hand will hit, distract, spring, spring. Your hand will hit, distract, spring, spring.
Okay.
Now, that was for the proximal row against the radius and ulna. Now we're going to just slide down 1 row, and you got to do the best you can. So here's her bump. This hand's going to slide past the bump onto the proximal row. This hand's just going to sit right next to it. My goal is to test the mid-carpal joint line using the same 9 directions. So here's my position. Distract, spring, spring. Now add a little distraction. Spring down, spring up, spring away, spring towards. Those are 4 translations. Here's 4 tilts. Tilt down, tilt up, tilt away, tilt towards. So this would have been basically flexion or anterior tilt, posterior tilt. This actually would have been, there's the thumb, that would have been lateral tilt. This is medial tilt. The hands turned over. Yeah.
I mean, how do you know what the end of range for extension or flexion is in that joint space?
You can feel it.
Because I mean, it didn't look like you didn't bring her to full extension.
No, but what happened is because my hands hit and I was distracting the joint apart, I took all those, I could feel all those tensions getting stiff, getting stretched, and then there's no place else for her to go other than to spring them. Because that's it, that's the elastic barrier. So if you remember that model of where these different lines are, we just need to get to that elastic barrier and then spring it. And so, yeah. Okay. Try these. Here we go.